snores and it's keeping me up all night. What can we do about it?
Yeah, it's possible that he could be sleep apneic and have sleep apnea. That can be a life-threatening problem. If you notice that he stops breathing sometimes, that's serious. And it's for whatever reason it's more and more common, and having sleep studies done is more and more common and more necessary. So the first step is to have a sleep study, talk to his physician, but we also have some options on the dental side, sleep apnea appliances that can be greatly helpful. Snore guards, snoring appliances that can slow that down, quiet that down. So we'd love to talk to him about that, and he should speak with his physician as well.
Okay, thank you.